have discussed a lot of strategies, but what does the evidence say works? Evidence-based practice is a key principle of governance within our profession and the CDNT. We look at available studies to see what handwriting interventions have the best outcomes for children and young people. Practice. This is linked to motor learning theories. Practice of handwriting is the most supported therapeutic approach to improve handwriting skills. Sensory motor. A 2009 study showed that young students demonstrated better results from handwriting intervention when sensory motor approaches were used, rather than cognitive approaches. This possibly indicates a developmental effect. However, sensory motor approaches on their own are not beneficial. Speed. Most programs to improve handwriting speed include lots of practice over a number of weeks in line with literature. Legibility. Most of the strategies are mainly cognitive strategies. Amount. Lots of practice sessions at home and at school guided by OT will show improvements. Practice at least twice a week and greater than 20 sessions was the most effective at showing improvements in handwriting. Some commonly seen difficulties with handwriting are that some children are movement seekers and have difficulty sitting still to write. Some strategies that can assist with movement seeking are checking to see if your child is in a supported sitting posture, using a move and sit cushion, which you can see here, allowing movement breaks and fidget toys while they're writing, using warm-up activities, writing for shorter periods of time, or using one-to-one direction while writing. Another commonly seen difficulty is that some children have lower muscle tone. Smaller muscles in our hands need to have a strong, stable core from which to work. Decreased strength in our trunk, stomach, or pelvic area will affect fine and gross motor activities. You can use some of the ideas seen here to develop arm strength and stability to facilitate functional hand use. These ideas include therapy ball activities, crab walking, couch push-ups, chair pushes and pulls, or tug of war. Another commonly seen difficulty is a lack of hand preference for writing. Children usually develop a preferred hand between the ages of 2 and 4, and hand preference is usually established between the ages of 4 and 6. To see which hand is your child's preferred hand, you can look at the following. Which hand do they generally use more? Which hand do they use to feed themselves? You can observe their play and see what hand they lead with, and you can see where they tend to position their toys while they play. You can promote hand preference by encouraging them to use their stronger hand. You can use words like the doing hand and the helper hand. You can encourage your child to finish the activity with the hand they started with, allow rest breaks, use hand warm-ups, and encourage activities that involve reaching across their body. Some examples are listed here. Another difficulty that we see is left-handedness. Lefties tend to have a natural left slant of writing. Some strategies to assist with this include tilting the sheet of paper to the right, keeping the left side of the paper parallel with the writing arm, holding the pencil slightly higher for more seeing room, or using a vertical slope board to help with wrist alignment.